Good afternoon, and thank you for joining our Changing the Narrative Black Breastfeeding Week 2022 virtual panel by the Black Mamas Matter Alliance. Please feel free to introduce yourselves in the chat while we wait for folks to join. Before we get started, we do have a few housekeeping items. Everyone is currently muted and will stay muted during the webinar. You can utilize the live captioning feature if you choose. We will have time at the end for a few questions, so feel free to submit your questions using the Q&A feature, and we'll try our best to address them after the panel discussion. Again, please place all questions in the Q&A section and not in the chat. Please note that today's webinar is being recorded and will be made available on our website soon. So welcome. My name is Clark Wheeler, she, her, and I'm the Federal Policy Manager at Black Mamas Matter Alliance. As the founders and leaders of the Black maternal health, rights, and justice movement, the Black Mamas Matter Alliance is a national network of Black women-led organizations and multidisciplinary professionals that work across the full spectrum of maternal and reproductive health. We operate at the national, state, and local levels and collaborate to advance policy, promote holistic maternity care, cultivate research, and uplift culture to advance maternal and reproductive health equity. All of our work is rooted in the birth and reproductive justice, respectful maternity care, and human rights frameworks. Of particular note, we use the phrase Black mamas to include a range of folks, from women and birthing people across the African diaspora to those who care for and mother our families and our communities, whether they've given birth or not. We stand in solidarity with all Black mamas. At BMMA, we approach our work through the goals of changing policy by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes, cultivating research that leverages community knowledge and Black scholarship, advancing care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas care, and shifting culture to dismantle negative narratives on Black motherhood and amplify the voices and experiences of Black mamas. We know all too well about the maternal health crisis in the United States, with the ratio of maternal mortality rising over the last few decades, and the impact is disproportionately affecting Black women and birthing people. However, it is important to note that these deaths are preventable and that solutions require policy and healthcare systems change. Additionally, statistical data alone doesn't describe the full complexities of maternal mortality and health disparities in the US. Fleshing out the historical context of present-day maternal inequities and reproductive injustices is key to addressing these issues. The regulation of Black women's reproductive decisions has been a central aspect of racial oppression in America. The institution of slavery in the US opened the door for all types of unjust medical experimentation on Black women's bodies, from experimental vaginal surgeries without anesthesia to stealing cervical cancer cells, all in the name of advancing science. At the same time, Black women have always organized, mobilized, and provided care to our communities. Such care work has informed and shaped medicine, nursing, public health practice, and the maternal and child health systems of the US. Black women's scholarship and organizing leadership have created lasting legacies in the global reproductive health and rights social movements. One such legacy is the coining of the reproductive justice framework, which Sister Song defines as a human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. Another legacy is the development of the birth justice framework. According to Black women birthing justice, birth justice exists when women and trans people are empowered during pregnancy, labor, childbirth, and postpartum, including breastfeeding and chest feeding, to make healthy decisions for themselves and their babies. Birth justice aims to dismantle inequalities of race, class, gender, and sexuality that lead to negative birth experiences. Taken together, the birth justice and reproductive justice frameworks help us better understand and contextualize our individual and collective experiences. These frameworks guide our discussion today, which will focus on the infant formula shortage in the United States. As an alliance, we condemn the ongoing infant formula shortage in the US. We assert that the shortage is a systemic failure that disproportionately harms Black women and birthing people, our families, and communities. Earlier this year, communities across the country began experiencing an infant formula shortage that was immediately attributed to broad supply chain issues and a recall of infant formula products from Abbott Nutrition. The Biden administration responded by invoking the Defense Production Act to speed up and prioritize infant formula production, flying formula from other countries to the United States, and increasing WIC flexibility in the number of brands participants can purchase. However, the shortage is still impacting communities across the country, and the root causes of this problem have not been meaningfully addressed. In response, BMMA issued a collective statement on the infant formula shortage in June. The statement changes the narrative about the infant formula shortage by applying a systems-level analysis of human milk feeding and infant formula access in the United States. The statement also includes a wide range of policy recommendations that, if implemented, would meaningfully address the root causes of inequities in infant feeding. As many of you know, today is the final day of the 10th anniversary of Black Breastfeeding Week. The week was founded by two of our panelists, Kimberly Seals-Allers and Kiddada Green, as well as Anaya Sengodele Ayoka. In honor of Black Breastfeeding Week, today's discussion will focus on the systemic failures and inequities we see in infant feeding, as well as the solutions we demand and deserve in our communities. I'll now turn it over to Milan Spencer to introduce our panelists and begin today's discussion. Thank you.
Thank you so much, Clark, for that grounding and historical context, very much needed. Greetings, everyone. My name is Milan Spencer. I am the Manager of Workforce Development and Partnerships at Black Mamas Matter Alliance. Welcome and thank you for joining us today. I am also a fierce advocate of breast chest feeding, especially in Black communities and communities of color. I am a certified lactation education counselor and a certified birth doula. I am proud to say that I have had 3 breastfeeding journeys, 2 of which I consider to be successful. And I am also thankful and grateful for the breastfeeding journey that was not so successful because of the lessons I learned and being able to understand exactly what we're up against as Black women who are accessing lactation services in this country. Without further ado, I am pleased to be joined by an esteemed panel of leaders today. So I will go ahead and introduce our full panel before we dive in. We have Kiddada Green, who is the founding executive director of Black Mothers Breastfeeding Association and co-founder of Black Breastfeeding Week and the Black Breastfeeding Caucus. She is a community organizer, thought leader, and social entrepreneur advocating for racial justice in maternal and child health. Her work has been published internationally in breastfeeding medicine, and she has been featured in publications such as Ebony Magazine, Women's E-News, and The Root. We also have Dr. Nastassia Harris, who is the founder and executive director of the Perinatal Health Equity Initiative and an assistant professor of nursing at Montclair State University. She is a registered nurse and an international board certified lactation consultant, or IBCLC, with over 17 years of experience working with birthing and lactating families. Her research and clinical interests include implicit bias and racism in healthcare, breastfeeding in the Black community, obstetric violence, high-risk OB, and reproductive justice. We also have Kimberly Seals-Allers, who is an award-winning journalist, author of 5 books, international speaker, strategist, and advocate for maternal and infant health. She is a leading commentator on birth, breastfeeding, and motherhood, and the intersection of race, policy, and culture. As the director of various on-the-ground community-based projects in several US cities, Kimberly is also deeply rooted in the lived experience of mothers across the socioeconomic spectrum. Last but not least, we have Dr. Ifeyinwa Asiodu, who is an associate professor in the Department of Family Healthcare Nursing at the University of California, San Francisco. She is a public health-focused nurse scientist, educator, and lactation consultant. Her research focuses on social and structural determinants of health during the reproductive life course, human milk feeding, maternity care practices, contraception use, and interventions. Thank you so much for joining us, ladies. We appreciate it. Okay, so let's dive right in. And this conversation is going to be very fluid. I may be asking questions directly to some of you, and I also want the whole panel to feel free to jump in, add anything that you may feel necessary, or expand on anything that you feel necessary to include. First of all, we are going to talk about kind of where Clark left off before she led into our introductions, which was about the infant formula shortage. So in the wake of this most recent infant formula shortage, many are trying to understand how we got here, how families are faring, and what this means for both infant formula and human milk feeding access in our communities. And I can say that as someone who has sustained a breastfeeding journey and had a journey where I relied heavily on formula, I had a very visceral reaction that I wasn't expecting to the infant milk shortage. And so I saw a lot of the narrative that was being had, especially on social media. And some of those were rooted in Black feminist frameworks. And some of those were reinforcing white supremacist values. In this vein, to start off our discussion, I'd like for each of you to discuss some of the narratives that you saw surrounding the infant formula milk shortage, and what, in your opinion, should we be doing to change those narratives to ensure that they are, at the end of the day, rooted in reproductive justice, birth justice, and human rights.
Good afternoon. Yeah, I'd be happy to start. First of all, thank you to the Black Mamas Matter Alliance for holding this space for us to have this discussion. I'm excited to really talk about it and what I saw, right? And so what I saw a lot happening on social media, and not just on social media, I want to be clear, it was also the press, traditional press, as well as leading press agencies, media agencies that were pushing the narrative of mommy wars, infant formula versus breastfeeding. And I didn't like it. It didn't sit well with me because it's misdirected, because our foundation and the root of the problem is not on the individual basis of mommy versus mommy. It's really on a systemic level of how did we get here? Why are we so reliant on infant formula? And where did the system fail us? And so I get really concerned and emotional to a point where it's disturbing when I see so many media, personnel leading with the individual mommy versus mommy. And it was very concerning to me.
Anyone else?
Good afternoon. I will echo Kiddada. I found the same issue, and what I believe is we have to consider the number of people who are formula feeding not by their own choice, but because they were forced into that decision, because they didn't have the support, they didn't have access. And so this narrative of just breastfeed or relactate is not a reasonable option for many people. And so we've had a system that has failed people. We don't have insurance coverage for lactation support in the way in which we should. We have a significant gap in the access of number of people that can't even support a family to reach their goal in lactating if that was their choice. So I think the issue has become convoluted. It's not just a parent who is choosing to breastfeed or chest feed versus a family who's formula feeding. Where we leave out is those people who are on those specialized formulas. Those are the ones that are really impacted, as we're seeing a significant shortage in those that need like pre-B formulas or Nutramigen. And so just breastfeed is not a solution for those families.
And I think to echo on what Kiddada and Nastassia said, the narrative also trended, did not adequately really describe and discuss the situation. This wasn't a situation that was created or started in February or May. This is an issue this is an ongoing issue, right? An ongoing structural issue that our most marginalized, historically excluded, strategically and structurally vulnerable families have been dealing with since the beginning of the pandemic and even prior to the pandemic, in terms of thinking about the families that are currently living in communities that are suffering from food apartheid, who already had limited access to human milk feeding, breastfeeding, and chest feeding resources, in addition to formula. And so this wasn't an issue that was just manufactured when the Abbott factory in Sturgis, Michigan went offline. This is a structural and historic issue that has primarily been impacting communities and families of color, in addition to our rural communities. And so that narrative was really left off. And it wasn't until our more white, more affluent, our middle income, higher income families and communities were impacted that it really became a national crisis. It wasn't a national crisis prior to others being impacted. It was almost like it was something that those families and communities had learned to kind of deal with and navigate through. And so that's a part of this story as well that wasn't lifted up in the way in which it should have been, really to address the ways in which our current practices and policies continue to harm certain families and privilege others.
Such a great point. Kimberly, do you have something to add?
Yeah, I just wanted to add briefly, in addition to what was said, part of the danger of that binary narrative, right? As Kiddada mentioned, it was either, you breastfeed or you don't. It left out much of the middle, which is also includes human milk donation and milk sharing. And when we have this very dangerous narrative, it's like either you're breastfeeding or you're completely dependent on infant formula. That's just not true. And so what we also saw were people who may not have been able to relactate back to exclusivity, but may have been able to relactate back to at least 1 or 2 bottles or something to help them, right? That combo feeding space. But we have made this very, definite line, which is dangerous when we know there's so much that happens in the middle. And I really want to lift up Ifeyinwa's point around this lack of conversation around commercial interests, right? This issue was a money issue, which was related to the ways that contracting happens in this country, the ways that companies are allowed to have monopolies and nobody checks it, right? And so, this idea of this being an individual issue when it was so far from that was really hard to watch, to see, the moms trying to battle it out on social media, when in fact, this was an issue around money and the ways that commercial interests seem to dictate our government contracts, access to things, where you can get, what you can get in your state. I mean, these are all issues driven by commercial interests, not public health and not what's in the best interest of mothers and families.
Absolutely. Thank you so much for that. The whole notion of just pick up the baby and breastfeed or chest feed them is so rooted in privilege. So it was very hurtful to see those narratives flying all over the place, even in the news. And that's a great segue for us to begin to talk about where we came from with all of this. And so Kimberly and Kiddada, as co-founders of Black Breastfeeding Week, you both are deeply rooted and involved in narrative change work surrounding infant formula and human milk feeding access. Can either one of you or both, can you provide some historical background and context on Black breastfeeding and chest feeding in the United States? And how has this history contributed to modern day infant feeding dynamics and inequities in our workplaces, homes, and in our communities? Whoever wants to take it first.
Well, I'll start. Oh, go ahead, Kiddada.
Yeah, I like to start from a place where we've come from, right? So in traditional West Africa, which is where many Black Americans come from, there's really no known like breast milk substitute, right? So Black babies are breastfed. Black babies are breastfed. So I like to really root it in that. But as you know, we arrived here in America and forced trauma through wet nursing, right? And that has impacted us as we move forward. As history continued, we were impacted by the mass marketing of infant formula directly to our communities. And even in the recent days, Kimberly and I did some work in Detroit where not only was it mass marketing of infant formula to Black families, but there was a community marketing of infant formulas in neighborhood stores where families were incentivized by taking their WIC coupons and receiving free TVs if they brought their WIC coupons to the store, or they would receive huge cases of diapers. And so I remember I felt like an investigative reporter at one point. I was going from store to store to really see like, what are people receiving to bring their WIC coupons to these stores? And Kimberly and I worked together. Kimberly's a journalist. She wrote an article, and all of a sudden it was not allowed anymore in Detroit for people to give more than in Michigan, for people to give more than $2 in incentives for folks to bring their WIC coupons to the store. And so this is what we talk about when we're talking about rooted in community and knowing what's going on in community, because it looks different in different places. There are themes in our culture that are similar, but when we talk about regional diversity amongst Black people and understanding what happens in individual communities, it's very important. And so I'm just going to bring it forward quickly. One thing that we don't talk about often is community milk sharing. And I like to call it community milk sharing versus informal milk sharing, because it is community milk sharing. And that was something that seemed to be shunned by public health agencies. They were afraid to speak on it. They would just get around the topic, or they would either say, we don't support it. And I found that very interesting in a time when mothers are really working to provide proper nutrition to their babies, to help their babies to survive and to live, when we have this option that's right here. But one thing that I can say about Detroit mamas is that they stepped up and they started community milk sharing. But I feel like there was a public health failure, because I feel like there's a need for public health to step in and say, here are some options to safely provide community milk to your families. And so that was bothersome for me. So I'm gonna go back again. We come from a place where if there was no known breast milk substitute, and all babies weren't put to the mama's breast, then how were they fed? They were fed through community milk sharing. And I feel like we have to uplift that and keep that in mind as we move forward, not just in a time of, not in a time when we're desperate and dealing with trauma immediately.
So true. And I would just add on, this year, our theme for Black Breastfeeding Week, as we celebrated 10 years, was new foundation, a new foundation, right? And that really resonated with folks. And it's so critical to understand like what we've created, because that foundation for breastfeeding when we got here was not ours. Our milk was not ours. Our bodies were not ours. We were really working for the system of oppression, right? And so what we've been able to do, and why we are always so honored by Black Breastfeeding Week, is to reclaim. It is about reclamation, taking back something that was taken from us, a way of reconnecting part of our motherhood experience that was ripped from us, right? That was corrupted and distorted by systemic oppression. And so when we get to do that, right, and however you choose to do that, but infant feeding is a part of a mother's journeys. It's our first job as a mother to feed your baby. And so when that whole experience is disrupted and or corrupted, the knock-on effects cannot be ignored. And then I just wanted to add that, we have seen historically the ways that Indigenous practices, things that are unique to Black and Brown folks, are often demonized by mainstream, whether it was, milk sharing, which was very, very common, right? Our sleeping habits, our sleeping patterns, many things that we did in our communities have been demonized by mainstream institutions and things like that, and public health entities. And I think that is also part of what that is also the reclamation work that we're in, and saying, this is how we're going to do it. This is how we're defining safe. And these are the mechanisms and measures that we're taking in our community. But I think this way of being, of saying, well, we are going to create something that's actually by us, for us and rooted in our knowledge and ideals is exactly what Black Breastfeeding Week is about.
Thank you so much for that. Great segue into the next question. I think all of us here are very keenly aware of the ways policies and programs impact Black mamas and families in our communities. So I'm posing this question to everyone on the panel. How have federal, state, and local policy responses to this shortage, how has that impacted our community's infant formula and human milk feeding access, if at all?
Yeah, I think we have to go back, and unfortunately, we live in a society that is not human milk feeding friendly, that is not family friendly, right? So we have a lot of policies and practices that are not equally distributed across the country. We have a few federal protections in regard to the Nursing Mothers Act and the Pregnancy Protection Acts and things of that nature. But then we have at the state levels, a state like California, where I'm from and where I'm based, that has some of the highest and most progressive breastfeeding and lactation legislation in the country. And so when we think about things such as paid family leave, when we look at maternal care practices such as baby friendly, things of that nature, and where they're located. It's not by accident that 1 in 4, 25% of women who give birth in our country have to return back to work within 10 to 14 days after giving birth. When one cannot prioritize being at home, bonding, providing milk for their infant, that then creates an over-reliance on formula and over-reliance on other feeding substitutes, right? And so we have to think back in regard to what are some of the policies and practices that could be more supportive of one being able to provide their own milk. Because another thing, I think, going back to one of the first questions that was asked, is that majority of families in the US start their infant feeding journey providing human milk to their infants. And then we know for various reasons within both on the infant and on the maternal side in terms of complications, preference, but just also not having the resources to be able to sustain a milk supply, in addition to not having enough. Many people often then have to supplement or combination feed. And so when we think about our policies and practices, paid family leave, lack of childcare access, baby friendly, fair, equitable wages, things of that nature, it makes it very hard for some families then to prioritize human milk feeding when they have other competing priorities in terms of their employment, securing their jobs and their place of employment, working to provide housing and transportation and things of that nature. In addition to another policy that just came to mind in terms of workplace lactation accommodation, we did a report in California where we found, unfortunately, that Black and Hispanic low wage earners were less likely to have access to workplace lactation accommodations, in addition to those who had lower English proficiency. And so again, we see these policies and practices that are afforded to some in our communities, in our society, that are not afforded to others, and thus perpetuate the disparities and inequities that we see in regard to human milk feeding.
Thank you. I'd like to add information regarding institutional policies for early child care centers, because in Detroit, we find that to be a major concern. We have had stories of families coming to us telling us that the child care center requires a prescription from the doctor in order for them to bring their breast milk there. We have had people come to us to help them to advocate for them being able to come into the child care center to breastfeed their children, because the providers didn't want them to nurse their children in front of the other infants. And so I want to make sure that this is a continuous part of the conversation, because there's a huge federal early Head Start program around the nation that focuses on mothers from the time that they're pregnant. And unfortunately, these people are not equipped to support mothers who are breastfeeding. And it's very unfortunate. And so if you're dealing with a job that's unsupportive, right? You've had to return to work early because we have a government with policies that are unsupportive of you having a maternity leave. And then now it's compounded by a childcare center that doesn't respect your wishes to breastfeed, or really doesn't even understand that there are some children that are going to be on a nursing strike until mama gets back. And how do I manage that? We have a whole failed system. And how can a mother manage all of this when there's so much coming at her? And so I want to really uplift that, because we have to get childcare centers on board, especially with so many dollars and so much money out there for early Head Start. And early Head Start is really focused on people who are low income. And if those people are trying to breastfeed and they're taking their child to a non-supportive childcare center, again, going to work to a non-supportive workspace, returning to work 10 to 14 days early, why are we saying this is a mommy problem? This is not a mommy problem. The system has failed us.
Absolutely. Thank you for uplifting those things. And I feel like all of what you guys spoke to, I've experienced. I've had, 2 successful journeys, but I feel like even in those successful journeys, we didn't even get our landing and my footing with breastfeeding until the baby was like 4 to 6 weeks. And at that point, many individuals are back to work already. And these policies that are lacking or are put in place as barriers often take us out of the game before we even get started good with breastfeeding.
Can I add a few things to that?
Sure, please.
I think there's policy, and then there's implementation and accountability of those policies. And I find, in particular, where I am in New Jersey, if you were to look on the books to see what laws we have that support and protect breastfeeding and human lactation, we would look like we're doing an amazing job. However, we have legislation that has been passed and sitting and unimplemented. So, for example, we have policies that say lactation consultants are supposed to be in network and insurance companies are supposed to reimburse us. But although that was passed in 2019, here we are in 2022 with no implementation of that legislation. We had donor milk that was supposed to be added into insurance coverage and policy. And so again, families still don't have access to that because while it was passed, it was not implemented. Our state also had legislation surrounding 10 steps to baby friendly. Every hospital in 2014 was supposed to be following the 10 steps, even if they didn't seek designation. But that came out in 2014 and now it's 2022. And who's checking to see if the hospitals are doing that? Where's the checks and balance that are in place? So it's great to pass policy, but there has to be follow-up and accountability for when we're passing this legislation, because just to pass it to say you did it is pointless. That doesn't help anyone. The other thing I wanted to add is there was no funding surrounding addressing this crisis. And when we had COVID-19, there were organizations that put out grants, things that you could apply for to support your ability to go and support your community. I didn't see that type of response happen with the formula shortage. There was no ability to expand scope of services for nonprofit organizations. There was no ability to have extra funding to source and purchase formula for families who needed it. So I don't think we got a funding response to be able to address that. And then the last thing I want to just add is our barriers to access. So while we have in some states really good leave policies, we don't have the ability to access those policies all the time. So to get customer service on the phone, if you have a question about your application, if you didn't fill out something right, then you're just, lost because there's no one to really help you with the implementation of those things. So again, just pointing back to, we need to have processes in place. If we know that you can go online to apply for this, but the place to go online and apply is not clear for people to find, then you're hiding the resources to me. And so I think that's sometimes on purpose. So I think we need to look at, where those system barriers are and be able to call them out to be addressed.
I would agree with that. And I think We also have missed opportunities at the federal level. The Pump Act, which would have guaranteed additional time and resources and support to nursing and lactating individuals, was not passed in the Senate, right? And then we also have to think about WIC. WIC is a huge purchaser of infant formula in our country, yet and still they had policies and practices which made it challenging for families to, even prior to the pandemic, it made it challenging for families that to secure infant formula when they were utilizing formula that was not being covered by their vouchers or their WIC card. And so it was interesting, during this pandemic, that some of those rules and policies have been relaxed, right? And so families then have a greater opportunity to be able to purchase what they see and what they can find versus having to go store to store, community to community to be able to utilize their resources, their financial resources, or their WIC card or vouchers.
I want to add to that around WIC being a huge purchaser of infant formula. I've learned that people also may not realize that early Head Start programs provide infant formula for the families. So you don't have to bring in any infant formula, which is great if you're using infant formula. But I also believe that if you're spending that type of money, you should also spend a considerable amount of money to provide breastfeeding support. We should not have early childhood programs that are federally funded without resources to provide breastfeeding support, to understand how to store and prepare breast milk. This should not be a problem when we have monies available to provide infant formula for every child that is in an early childhood program that's federally funded. We have to do better. And that just goes back to what Dr. Harris is saying around funding and how are resources being utilized.
Absolutely. Which is also a great segue into now what can we start to do? So I think we all know that systemic policy change can be a slow process. And so for the whole panel, can you guys speak to ways that Black-led community-based organizations provide immediate and direct infant feeding support to Black mamas and families? And what does that look like on the ground?
So I'll continue on my soapbox about early child care centers, because one thing about Black people is we don't really wait on policies, right? Because we know that it's slow. We know that our families need it, and we think about what we can do to help out one another. So one thing that we do at Black Mothers Breastfeeding Association is we partner with Focus Hope, which is an early childhood provider that's federally funded. And we have utilized the Carolina Global Breastfeeding Initiative's breastfeeding friendly childcare curriculum. And so we have been working with them to make sure that they have policies, to make sure that they're supportive of breastfeeding. And it's been a great partnership. And Focus Hope is doing great things around breastfeeding and supporting the families that are there. And so I think that those type of collaborations are very important when we're working with community organizations and early child care centers. And so while we are working and pushing policy forward, Black mamas, Black people, we're not waiting on it. We're on the ground, we're doing the work. So I just want to say shout out to all the folks who are in community getting it done, working on practices and changing institutional policies, while these things that are happening at a local, state, and federal policy are moving at a snail's pace.
Right. And I also want to lift up, while folks are doing the work, because we know that and we see that, and they're in the best position to do this work. The folks that are at the grassroots are CBOs, because they're already working with and embedded within these communities. They know what is needed within their communities. And so sometimes, to Nastassia's point in terms of no funding, there was some funding allocated, right? But in terms of where it was allocated and who it was allocated to, didn't necessarily go to those that were doing the work. And so really calling that out in terms of not necessarily allocating resources to at the state level and or at organizations that typically kind of gather funds and hoard funds, but really funnel those funds to Black-led, community-based organizations that are already embedded in communities, already have relationships and rapport, already are doing needs assessments, right? They already know what is needed. And so making sure that those people are adequately funded, that those organizations have the resources to better support their communities, because many people they were in those streets, they were checking in on families that they had been supporting during their pregnancy or immediately after discharge from the hospital. They were making sure that they had the infant feeding education that they may not have received during their pregnancy or in the hospital, making sure that if they needed formula, that they were connected to other organizations, food banks, diaper depots, things of that nature. And we even saw some organizations creating community milk depots and really being bridges and connecting families that they know, oh, you have some extra milk. I know there's a family over here that needs milk. They were doing the work that often goes unsung, unlifted up. And so, you know, again, to Kiddada's point, we're not sitting around waiting for things to happen, because if we were to do that, we would be in even more dire straits than we are right now. And so it's really about listening to communities, listening to Black women and birthing people, and really funding people who are doing this work.
I'll add that we also as organizations need to be creative with how we utilize our funds. I think as an organization, we had focused on doing the work ourselves and really didn't think about expanding how we can partner with other people. So we created a scholarship this year so that we can then use our funding to fund others to go get certified. So that increases the workforce. I think just understanding how our community works, especially when it comes to lactation. When I was in private practice, I would find families would struggle for weeks before they would come find me. And so that really made me think is we need to be reaching out. We cannot wait for the family to come to us and say, I'm struggling with this. We need to look at our checkpoints. We know that right after delivery, people are going to have a hard time. Often in the hospital, when we have either not existent or not great lactation support, they're probably going to need you to come into the hospital and see them there within that first week after discharge. So making sure that we have a schedule of checkpoints so that we are doing that due diligence of checking in with our families and not waiting for our families to come to us, I think is really important.
And I would just love to follow up on Dr. Harris's comment, because I think another thing that, you know, is really, really critical for those working on ground to do, to Dr. Harris's point, is to think about who else is not in the conversation. Many times we're very much heads down, but if we can open up to other community-based organizations who can assist in this work, right? And so we think about breastfeeding is not just the job of those in the breastfeeding and lactation support field. Like, breast milk is a food, right? And so who's doing the food stuff in your community? Kiddada and I worked on this in Detroit, where there's a robust community talking about healthy foods, and food starts from the day you come out of the womb. And so how are we connecting to these other broader movements? Kiddada mentioned childcare centers. You know, we can think about who's doing what on the community around food systems. There was a lot of food banks opening up in the pandemic, and in many places where we work with folks to make sure that there was a lactation consultant going there, because those food banks were handing out formula, right? And so where are the other community organizations that actually can be allies and partners? So it's not just on us and the very small, you know, predominantly under-resourced folks, but that we could think bigger around breastfeeding being not just about those who are in the lactation space.
Yeah, and I want to follow that in terms of, and I don't think we talk enough about what happens in the hospital. What happens in the hospital and during prenatal care, right? In terms of whether someone is provided education and resources and are connected to what is in their community during their pregnancy. And then also what happens during labor and then after birth. Unfortunately, we know that Black infants are 9 times more likely in some communities to be supplemented with infant formula. And sometimes that is not necessarily due to a medical need. and or parent choice, right? And so we have to take a step back and look at what is happening to cause some of that unnecessary supplementation. In addition to breastfeeding, baby-friendly practices, policies and practices, maternity care practices that are supportive of human milk feeding are often not found in Black communities. And so again, there are missed opportunities to provide the education and resources at critical time points, right? And not only thinking about after discharge, but prior to that, how can we set people up well so that they on discharge are in good positions or in better positions to be able to meet their infant feeding goals. And then again, going back to understanding and realizing that, again, not all families are going to be in a position to utilize or provide human milk for their infants, making sure that those families too have the education and resources to be able to provide proper infant formula or have access to donor human milk. Because even though one is using infant formula, they still need to know proper formula preparation, right? Because then we don't want to have issues with malnutrition, with folks diluting formula, trying to make it last longer, and or overfeeding of formula where folks are adding cereal and other things, increasing the caloric intake of formula, which increases weight gain. And we know infants aren't able to burn that off. And so it puts them on a different trajectory. In addition to people making homemade formula, which also puts their infants at greater risk. And so some of those are some of the things too that we often don't talk about, where we also need to increase education and policies and practices to prevent these issues from happening.
May I just quickly add on the hospital piece too, because we see this so much in the EarthApp reviews, right? So in the EarthApp birthing track, we ask specifically about the doctors, nurses, and lactation consultants. And we have found in analyzing our data that even in baby-friendly hospitals where people have said, I went to a baby-friendly hospital, but this is what happened to me, right? And so we know that this hospital is ground zero, and we're seeing even in our EarthApp reviews, the ways that people are not being supported, the ways that actually the policies that are supposed to be in place because they are in a baby-friendly institution are not being applied to them. And then the other side of that, one of the things that was so interesting was that we saw a high correlation between when people are having a good breastfeeding support experience in the hospital and their overall experience, right? When people felt like the breastfeeding support was a 1 or a 2, the whole hospital was a 1 or a 2, right, overall. And so it really matters to people that they can get this support. And so this is an important thing around, if anyone's point around the hospital being ground zero, and many people are either having a bad experience, having this early supplementation, which is one of the things that can lead to decreased breastfeeding at 9 times the rate of what white women are experiencing in hospital supplementation. And then they're having this negative experience where they're not even being supported, even within hospitals that are supposed to be doing that. And so, these are the disparities and the ways that racism and bias show up, even in our lactation support, that we all, have to be continuously aware of.
Thank you so much for that. And Dr. Asiodu and Kimberly, you guys brought up some great points, especially around missed opportunities in the prenatal period and in the hospital. And you guys have also touched on what I'm going to ask next. So if anybody else would like to expound, what do you think can hospitals, providers, and larger health systems, what can they learn from Black-led community-based organizations when it comes to human milk feeding initiation and support?
They need to know who we are. I think step number 10 is that community partnership, and that is missed consistently. There is no relationship between the community and the hospital, at least not for the populations that the hospital is serving. And I think that's a big misstep. They need to have us on their advisory council boards. They need to know the work that we're doing. They need to be proactive in making the referrals. There has to be that continuity of care is missing. We send people home and then you're on your own. And where we are missing, I think, the boat, and we were just talking about this within our own organization, is we focus a lot on the OBs, but the pediatrician is going to likely be the first person that sees this dyad once they're discharged home. And so what are we doing to work with them to make sure they have the right sets of information, because they really can undermine breastfeeding quite significantly if they're giving the wrong sets of information. So I would say one is to know who's in the community doing that work, but then also, like, if you don't care about breastfeeding, it's not important to you, then refer your patients to other people. Like, you don't have to make up your breastfeeding information. You don't have to, add your own spin on what your personal experience is. There's no reason to do that. So if you just hate it, then, say that and refer them to someone else that wants to actually do that work. I think that's really, there's too much misinformation out there. That Google is too accessible to just make up things about breastfeeding. And I think I am personally over that. So I'm going to shut up now, but I think that's my thing.
No, I think that's great. I think too, hospitals need to recruit and retain a diverse workforce. They need to, folks want to see people who look like them are in their communities taking care of them, right? We know the importance of, in the data in terms of the impact on outcomes in terms of racially concordant care. And so we know how important that is. And unfortunately, when we're thinking about our healthcare workforce in terms of physicians, nurses, advanced practice nurses, midwives, lactation consultants, we're not looking at a very diverse workforce. And so that's something I think hospitals and birth centers and others that care for pregnant and postpartum families can do in terms of really recruiting and retaining, right? And it isn't enough to just hire people. You need to create an environment that's inclusive where folks want to stay. To be able to support their communities. I think in addition to that, really thinking about how these policies, how this education is provided. Oftentimes breastfeeding classes, along with childbirth classes and things of that nature, there's a fee associated with them, which creates a huge burden for some families. And some hospitals will offer scholarships or free classes to a certain number of patients. But we have to think about the ways in which that further stereotypes and perpetuates people, and the ways in which we use language. For some people may not want to apply for a scholarship, and or the application may be another burdensome thing or process that folks have to go through. And so thinking about how is there a way that we can provide this really critical information, because everyone really should have access to childbirth education, to breastfeeding and infant feeding courses, to parenting classes. That shouldn't be limited to just folks who have the financial means and to be able to pay for them. And also thinking about when the courses or the classes are being offered. Are they being offered at a time that best fits the needs of the communities and the families that you're serving, right? And so I think there are a number of different ways that hospitals can also really improve and better support families. And then lastly, thinking about lactation. Oftentimes in the research that we do at the Milk Research Lab, we hear how critical the lactation consultant was in terms of providing education in terms of the theoretical impacts of early contraceptive use immediately after birth and its potential impact on lactation, and or really asking critical questions of families. But we also know that not every hospital has a lactation consultant. And for those that do have lactation consultants, they may not be available 24 hours. They may be only available during that daytime, that 7 to 7. And so those who give birth in the evening or at night or then don't have access to any lactation support into the morning. And so we have to think about then, are there other ways or other models that we can provide around the clock lactation support and services to families to better support them? Because folks are not only giving birth during the daytime, and they don't only have challenges with latch and with positioning during the daytime. They also need that support in the evening. And then so also one last thing, in terms of thinking about our policies and practices around who can be a lactation consultant in hospital settings. Oftentimes it's relegated to nursing. And so does one need to be a nurse, IBCLC, to be in the hospital? I would argue no. And I'm a nurse, IBCLC, right? And so we have to think about our policies and practices that limit us and that really impact us in the ways in which we can provide these really, really critical services and supports.
Thank
Can I
you
just
so much.
add, because
Sure.
we are working on a study which Dr. Asiodu is helping us with, and just in regards to that question on childbirth education, we asked that question: how much would you be willing to pay for a childbirth education class or a breastfeeding class? And the answer was, but the highest response was between $25 and $50, and followed by, I would not pay for a class. So if that is the barrier, then we know that there's not going to be access, because this was regardless of whether you could afford to pay for it or not. You did not want to pay for it because you felt like your insurance should pay for it. So I think that's a significant gap. And then I think the other thing I need to add for myself as a nurse, what we're finding in our research is nursing is responsible for the damage that's happening, not exclusively, but when we dug and kind of asked what happened, specifically in the NICU, nursing was responsible for undermining breastfeeding. And when we are the profession who is supposed to be the most trusted, who is supposed to be educated and having the ability to support these skills, and we're the ones that's destroying it, we need to kind of hold our own accountable for what's happening, because we are responsible. The data is telling us that nursing is part of the problem. So I think, again, that goes back to how we're educating our nurses, what additional training they're getting, how we're utilizing our own personal experiences as our own motherhood journey to implicitly damage other people's journey. Those are things that I think that we're not talking about enough, but nursing has had a significant role in undermining the success of breastfeeding. And I think I want to just end on just acknowledging that human milk is, that decision is not just how we're choosing to feed our babies. It is a healthcare behavior. And we could really look at breastfeeding, chest feeding as a public health initiative, and not just solely as a way that we're feeding our babies. Perhaps we can think about how this is being impacted a little bit more deeply. There's so much that is lost. And we cannot keep using formula as the solution to all breastfeeding problems. You don't fix a latch issue with formula. You don't fix a low glucose with formula. There are different other ways and techniques that we could do. So is it a skill set issue? Is it a knowledge issue? But I think there's something that's being lost in translation in the hospital.
Yeah, I think it's a public health issue in addition to a reproductive justice issue, right? And so when we start to use different frames, it opens up the opportunity to partner with other organizations and that are also doing that work, right? When we say that human milk feeding and lactation are public health issues, then that allows us then to partner with our colleagues in public health, right? What are those home visiting programs? Making sure that those curricula and those staff, right, the public health nurses, community health workers, promotoras, that those folks also are well-trained and well-versed in supporting human milk feeding and infant feeding in general. In addition to when we're thinking about this as a reproductive justice issue, it also opens up the opportunity to break down silos. Oftentimes, this issue is very much framed as an infant health issue, very rarely framed as a maternal health issue or a woman's health issue or a reproductive justice issue. And so once we start to break down those silos, it allows us to have different types of conversations and have different people at the table so that we're really truly thinking about pregnant and postpartum individuals and families across the reproductive life course and across their life course, and not only thinking about them in these specific time periods, which really is limiting.
Thank you so much for that. One of the things as we wrap up this discussion around the infant formula shortage. Why is it critical for us to simultaneously advocate for high quality formula production and preparing safe formula, and also advocating for human milk feeding initiation and support? Why is that critical, especially in the lactation communities?
I think to the point that we made earlier in terms of this is not a binary issue, right? We can support both at the same time. The most recent CDC breastfeeding report card says when we're looking at exclusivity among Black women and birthing people, around, I believe, 36% were breastfeeding exclusively at 3 months. And at 6 months, I think that went down to 19%. So what does that tell us? That tells us that a majority of folks in our communities are supplementing, right? Due to many of the systemic and structural barriers that we've already raised, are not being able to provide human milk exclusively to their infants within that really critical time period. And so while we're still advocating for the importance of human milk feeding, and we're still advocating for that, we also have to prepare families for if that supplementation happens. We don't want them to, we want to be able to prevent instances of malnutrition and overfeeding. We want to make sure that folks feel adequately supported and ready to be able to properly care for their infants. And so we can do both, right? We don't have to, it doesn't have to be this fight or this tension. And so when people talk about you can only you have to try and choose sides and things of that nature, I just kind of shake my head and say, no, that's that's an oppressive way of thinking about this work. You don't have to, it's not a binary decision. We can do all the things. And when we do that, our families are the ones that benefit. There's a reason why formula companies want us to be in those mommy wars and really kind of pitting lactation support persons against families. It really supports their bottom line when we're fighting and when we're not thinking about the systemic and structural issues. And so we can do both. We have to do both because we do not live in a society that is supportive of exclusive human milk feeding right now.
And I would just love to add, since we're on this panel talking about shifting narratives, I mean, this is critical to shift the narrative, right? Because the prior narrative has been a language of breast is best, or, which doesn't really include thinking about the mother and the family and the parents. A lot of focus on lactation support is about the latch, but what about the rest of you? And so if we really want to change the narrative, that includes, showing that we care about the whole person and that we care about their whole journey and not just about the breast. Like, we understand that was effective messaging for a certain time and for a specific need, but when we continue in that lane, it comes off as if we don't care about the rest of the person, whether they're having mental health struggles or whatever, they have to go back to work, all the things that we've discussed, and that we're ignoring the systemic failures all around you, and all we care about is that breast and that latch, right? And that dangerous narrative that has contributed to what Ifeyinwa was talking about, this pitting, right? And these wars that often exist even within the breastfeeding community. And so we are rejecting that. And I think this is actually what the Black leaders in the lactation movement have been rejecting. That prior narrative comes from a movement that was white female led, where breastfeeding wanted to be a privilege, was a privilege. And we are saying we are expanding the definition of what that looks like for our communities to make it more inclusive, make it more expansive of the many ways that breastfeeding happens in our journeys, right? And so that is a critical part of how we can change this narrative. And I want to honor the fact that that is being done best by the Black people who are leading the lactation movement right now.
Absolutely.
We have to do both. And I would just add that formula feeding needs to be done safely. We have a duty to educate. And when we talk to families and ask them how they prepare their formula, there is still this misconception that you need clean water. And of course, yes, there are definitely spaces in our country where we don't have clean water, so using it from the tap wouldn't be the issue. But if you Google how many times powder specifically has been recalled for things like beetle bugs and all other kinds of things, it is the boiling of the water and the preparation of it so that it is killing the nutrients. Most of our families who are using, sorry, not nutrients, the bacteria, most of our families who are using formula are using powder, and powder is the least safe form of formula to use because it is not made under sterile conditions like a ready to feed is. And so we need to teach families how to do that. How long can that formula sit out once it's been opened? How are you supposed to sterilize your bottles? How often are you supposed to do it? Pace feeding. Pace feeding does not belong exclusively to breastfeeding and chest feeding. Every baby should be pace feeding. There's no reason why any baby, I don't care how old they are, should be taking 8 ounces at a time. It's an unnecessary volume, but when we don't teach that component of it, then the volume continues to go up and up and up. And so we still have to have those conversations of the education that goes along with whatever that feeding choice is. We have to support whatever they go along with, but we need to provide the education that's associated with it as well. And that's important.
Thank you so much for that. Kiddada?
Yeah, I think that sometimes some of the struggles that we see in Black Mothers Breastfeeding Association is that people don't know how to make breastfeeding fit and work in their lifestyle. So I'm a strong advocate for mother-to-mother support, peer support. And so our signature work, Black Mothers Breastfeeding Club, has been running without interruption. I'm very proud of this, since 2008. And it's also been replicated in 2 other states. But what mothers learn there is how to make breastfeeding fit into their lifestyle. It's a socio-cultural similarity. And so I'm gonna push that because sometimes when we're choosing, or sometimes even when the choice is made for us and supplementation happens, it's because we haven't built a network of support. And so I want to strongly advocate for those spaces of similar folks, Black folks of similar sociocultural background, to come together and learn how to make this fit into your lifestyle. It's one thing for me to tell someone something, but if I have a sister sitting beside me, oh yeah, I think I know you. Didn't we go to middle school together? And we start talking and you're telling me about your experience and how you return to work and how you built your community and your village here supports you. And now this fits into your lifestyle. That is a very effective, best practice way of making breastfeeding work for us. So I want to put that out there and share that with you all. And let's figure out how to help these Black mamas make this fit into their lifestyles.
Yeah. And one last thing I want to add to this is that, as you can tell from this discussion, we all understand the importance of infant formula, right? Even though we're huge human milk feeding and lactation advocates, we all understand that formula has a place. I think something, and this is something I learned from Kimberly, in terms of we also have to make space for those that exclusively formula feed. Right. And then sometimes when we demonize, or there's this perception that those who primarily utilize formula are less than or demonized in a way, it really sets a negative, it really sets them down a negative trajectory. We also know and understand that each infant feeding experience is different. Because you provided formula or utilized supplementation the first time, if you have subsequent births and infant feeding experiences, doesn't mean that you can't engage in human milk feeding other times. And so we have to make space for those. We have to listen to families, and we have to make space for journeys and experiences that look differently. And we have to be supportive of that, understanding that there may be another opportunity for a family to provide human milk to an infant in subsequent pregnancies, and or engaging in a way in which we talk about donor human milk in hospital settings, or not talk about, right? and/or community milk sharing and things of that nature. We have to make space for all of the different narratives and experiences, because everyone doesn't have the same privilege and opportunity to be able to directly feed at the breast or chest, have ample paid family leave, and really, be able to do that. So we have to make space and time for other experiences.
And I would like to just uplift too, on that same vein, that exclusive pumping is a viable means of providing human milk, and we cannot deny people access to a pump. If someone comes into the hospital on day one and they want a pump, give it to them. Explain to them how it's going to work, because I know the other side of why we don't want to do that. Is because of this conception of setting people up for failure, because we know the pump is not as effective early on. But are we teaching hand expression to families? Because that's what we should be doing on day one of delivery, or really prior to that. And then I just want to uplift again what Kiddada said about the support groups. I am coming to someone as someone who has breastfed my last baby 8 years ago. I don't have a current lived experience of breastfeeding. And so I may not be the right person to steer some of these conversations. So someone who is actively in the throes of breastfeeding, some of the things that I hear in these groups, I'm like, I would have never thought to do that, but it's coming from the genius and the ingenuity of our mamas. And so we need to definitely make space for that.
Absolutely. Thank you guys so much for that. And as a lactation educator, I often get to talk to healthcare professionals who speak to clients about breastfeeding. And one of the things that I make sure to let them know is that no one cares what you know until they know you care. And I feel like we can care for all families, all babies, all feeding journeys. And it's okay as lactivists and as breastfeeding activists to care about all of these journeys. And so thank you guys for centering that and uplifting it. I know a couple of you already spoke to this. Black Breastfeeding Week is an opportunity for us to celebrate and honor our collective resilience. And I want us to take a moment to just revel in the celebratory nature of Black Breastfeeding Week. And this is the final day. Why is it important for us to uplift our personal and collective narratives about our infant feeding experiences? And I know Dr. Harris and Dr. Asiodu, I think you guys both mentioned why it's so important for us to share our own personal stories and for other families to hear the personal stories and journeys and collective narratives of their peers. Is there anyone else on our panel who would like to share why this is so important for Black breastfeeding in our communities?
I would just like to add, I think one, what Kimberly, Kiddada, and Anaya created 10 years ago was a game changer. Because a lot of what was in the literature at that time, and unfortunately still is this negative narrative around disparities, and that Black women don't do this, or, and so by creating Black Breastfeeding Week really offered an opportunity to really shift that narrative and to really highlight what was working and what is working within communities. Because that's often not lifted up in the literature. There's more of a deficit-minded ways in which folks talk about Black breastfeeding and research. We're seeing a shift in that now, slowly but surely. But this week really offered an opportunity to see what was happening in communities across the country and to realize, folks are doing this work. They're doing it often underfunded, under-resourced, but they're doing this work, right? And it's been amazing to see it grow over the last 10 years, but also to see, for some who may not even known this was happening in their own backyard, or it was happening within their states, things of that nature. And so they really created an opportunity to move beyond the negative narratives and to really see the beauty in Black breastfeeding.
Thank you, Ifeyinwa. I just want to honor that was actually intentional. I always let people know that during Black Breastfeeding Week, we never talk about what's not happening. We never spend time on disparities and deficits. It has always been about uplifting where it is actually happening in our community, creating space for people to see that it is happening in our community. And then our signature event, I think maybe that started year 3, our baby lift ups, where people are coming out and lifting up their babies, breastfed, formula fed, anything fed, right? We also create a space of empowerment, because the breastfeeding is bigger than just around that infant feeding period. And it was bigger than just us being concerned about your breast or how you are using it to feed your child. And so I think these are the, as we've been discussing, the broader themes that have resonated with people, and really allowed us to kind of invite folks in. Now, when people say, many times in these Zooms, and nurses or other folks like, what can we do to tell people about that Black? I was like, if you need to tell them to open their phone and go to Instagram, because they're already there, and put in Black breastfeeding as a hashtag and just scroll, right? It's like, it's happening. And, for me, Black Breastfeeding Week has been a big part of that. And so when people are trying to say that we don't do it, it used to be one Facebook group that you could go to. Now we have so many places, so many sources. And so that, for me, is really the beauty of what Black Breastfeeding Week has allowed, and that has been encouraged, and for people to find a home to actually lift all that up during that week. And so I hope everyone continues. Obviously, every day is Black Breastfeeding Day for most of us here, but also lifting up, this intentional time that we've had every year to make sure that folks know that this is happening in their community, connecting it to policy, and celebrating it as a thing, right, that we are reclaiming, that we're doing.
Yes, thank you.
So Black Breastfeeding Week has been one of the greatest joys of my work. And it just brings me so much excitement to celebrate the 10th year. We had a huge, magnificent celebration yesterday, and I'm overwhelmed to say that one thing that we, as Kimberly saying, we've always been very intentional about is being asset-based, because we often talk about the trauma and the hardships that the Black community has, but sometimes forget about the joy. And we want to uplift what people are doing. And we don't just want that to resonate with folks during Black Breastfeeding Week. We want that to resonate with people throughout the year as they're doing this work. So celebrate all year long. We have wonderful Black mamas, wonderful Black babies, breastfeeding experiences. Just keep it up and keep the celebration going throughout, and grounding your work in joy and assets. It actually brings you joy. And it's good for the spirit. And so that again resonates throughout the community and the work that you're doing.
I would like to wish y'all a happy 10th anniversary and thank y'all for creating this week, because it has grown. Every year we see more and more people get involved and honor and celebrate it. And I think what I would like to add as far as the visibility is you can see who in the community is doing this work. And I would like for people who are in a position to develop programs, to fund initiatives, to look at that. There are already Black-led organizations who are doing amazing work, who you could pay them to replicate their model and implement something in your own community. It doesn't have to be reinventing the wheel, and it doesn't have to be white-led models that are leading that change in your community. There are plenty of Black-led models that are working really well. And what this week does is give an opportunity for people to see who those people are and the work that they're doing, fund those organizations.
Excellent. In the interest of time, I think I can only get to one question that was posed from, actually, a few of our audience members submitted something very similar. So I'll just ask the question, and if we can be brief on responses, that would be great. How can we advocate for and support policy change about community milk in the hospital and at the public health level, when much of the framing of human milk focuses on the bodily fluid part, which can be potentially infectious? I wonder how I wonder about this, especially with implications for punishment, either criminally or through child welfare. And we had a couple of similar, how can we make this more accessible in hospitals, community milk sharing practices?
Yeah, so institutions and hospitals, doctors, they really respect their colleagues and the research that is gone about it. And so the Academy of Breastfeeding Medicine has a protocol for community milk sharing. And so if your institution and hospital is looking to be supported in what you do, then I suggest you read the Academy of Breastfeeding Medicine's protocol for community milk sharing. And it has the guidance, the research, and talks a lot about what's safe and how to do community milk sharing. That's my suggestion, because it's there and it's done by your peers and your colleagues. The research exists.
Yeah, I would also lift up the California Breastfeeding Coalition conducted a webinar a few weeks ago on community milk sharing, where we had the lead author of the ABM, the Academy of Breastfeeding Medicine, Dr. Sharenka, present. And so if you are available and have time, I would definitely suggest going to review and watch that webinar. In addition to that speaker, we also had Dr. Anjali Palmquist, who's also done a great deal of research on community milk sharing, both here in the US and abroad, also share in terms of the research. And we had Brandy Gates Burgess, a community member, talk about her lived experiences as a donor to different families within the Bay Area. And so I would really suggest going to watch that webinar. In addition to Eats on Feets also has the 4 pillars of safe community milk sharing. So there are websites and resources that hospitals and organizations can go to learn more about best practices and safe practices to better support community milk sharing.
And just for clarity, the CDC does not classify human milk as a bodily fluid. That is a separate entity.
Great. Thank you so much, everyone. And in the interest of time, I'll go ahead and start wrapping up. But I do want to take this moment to thank each and every one of you on our panel today. It's been a humbling experience to share space with you, all 4 of you. I have looked up to in my journey and in my professional and personal journey with breastfeeding and lactation. So I thank you guys all for being here on this last day of year 10 for Black Breastfeeding Week. And I honor all 4 of you. Thank you so much. All right, so really quickly, we're going to wrap up, but I do have a couple of things to share with our audience before we do officially end. I want to make sure that I uplift and center our upcoming Black Maternal Health Conference and Training Institute. Virtual registration is still open, and I believe we may be coming up on the end of the general registration price. So please, if you feel like you want to tap in for our Black Maternal Health Conference and Training Institute coming up September 17th and 18th, please register for our virtual option that is still open. Follow BMMA on all of our social media platforms. And if you go to our website, blackmamasmatter.org, you can sign up for our e-newsletter to receive the latest information and resources from us. So be sure to do that. And again, a big thank you to everyone who registered and joined us today. Thank you to all our panelists for this dynamic discussion, and be safe and have a good one. And happy Black Breastfeeding Week. This was an amazing week as always. Thank you guys so much.